students, and welcome to the session. In this session, we will be discussing about, the main learning objectives in this session will be to read an orthopedic X-ray, especially during your Viva examination, and the second part will be the approach and reading about the orthopedic specimens in the same Viva examination. So, I will be dividing this session into three parts. The first, we will be covering the trauma series X-ray. I will be taking you through several examples and how to read about individual X-rays and what are the common questions or potential questions that might be asked with that X-rays or that case example. And the second part, I will be discussing about the cold orthopedic topics, which is primarily covering the orthopedic conditions of like inflammatory conditions, metabolic, infective, and most important topic for X-ray point of view is the tumor conditions or the orthopedic tumors. So, before we go into the detail or discuss individual cases, there are certain thumb rules while getting an orthopedic X-ray. The first, it is known as the two rule theory. The one is you always get an orthopedic X-ray in two views. It is always better to appreciate a given film or a given condition in two views. We have antero-posterior view and the lateral view. So, it is you are viewing the limb in two different profile. So, that gives you a better three-dimensional idea about the underlying condition. So, the second important rule that we always follow is to involve two joints. That is, you always involve a proximal joint and a distal joint to the condition that is seen on the X-ray. Apart from these two fundamental important rules, we also have couple of other rules such as getting two sides. That is, you always compare certain conditions may be unilateral and sometimes the condition may be bilateral. So, it is always better you get the X-ray of the opposite limb and then you can compare the conditions that will help you in identifying the primary pathology. The other part is sometimes you may have to get X-rays on two different occasions. A classical example I would say is a scaphoid fracture. On an initial acute scenario, an X-ray may appear normal. So, it is possible that the fracture might be completely missed. So, when the swelling everything settles down and a repeat X-ray is performed a few days later, it may be possible to appreciate the X-ray. So, it is always assumed that you better get X-ray at two different occasions. And lastly, it is always better to have two different perspectives like two observers reading a X-ray. Sometimes the primary observer may miss out key important findings that is useful for planning any intervention. Okay. So, with this background, a very common phenomena that I have observed during Viva examination is whenever an X-ray has been put up for discussion for the UG students, the first thought process is there is always some form of confusion in how to articulate or how to start. There is always the problem of the starting trouble that is always seen in these scenarios. So, I will just give you a brief idea how to start about, and that will make a better impression upon the examiner when you start describing the X-rays and the specimens. So, remember this template that I have just put up. So, it is a common confusion that how you start thinking about how best you can describe the area of interest, but the examiner is more interested in how you approach in reading the X-rays. Okay. So, an X-ray film is not just the area of interest, there will be other areas in the X-ray film and that also needs to be described by the candidate. So, the first and foremost easiest part of reading the X-ray is identify the region. Whenever we put up an X-ray, you start off by saying what is the region. The region, I mean which area, which part of the body are we discussing. As soon as you see the X-ray, that gives the first impression that you are describing the right area. So, it could be a region like shoulder joint, a pelvis, knee joint, ankle. So, you always start off by describing the region. The second part is identify the view. Like I said in the beginning, we always or most instance we tend to get X-rays in two different profiles, antero-posterior and the lateral, which is much more common. Sometimes in different occasions we may have to take different or special views, but in general it is usually the antero-posterior profile as you see the patient from front to back and the lateral profile as you see it from the side. So always describe the view. That is the second important point when you start off describing the X-ray. The third part is you describe the bones that are seen. So which is basically you are refreshing your anatomy knowledge. So describe the bones that are seen in the X-ray film. Okay. And the fourth point is the bone which is actually involved. So you start off the area that you actually wanted to start in the beginning. So that comes as the fourth point. So you want to describe the bone which is actually involved as the fourth point. The fifth part is now which is actually the area of interest. So it could be a fracture, it could be a tumor condition, an inflammatory condition, whatever that may be the part, that comes the fourth or the fifth important point. And sometimes it is possible to describe the condition of the soft tissues even on X-ray films. I'll take you through some examples, so that will give a much better idea regarding what I'm actually trying to tell here. So let us start off with the cases. This template remains throughout the series, so that will help you in determining the or understanding this whole exercise as I take you through the case examples and the X-rays. So let us start with the first case. Okay, as soon as you see the case, it becomes very difficult for the candidate to articulate how do I begin with this description. So as I started off with the template, keep that in mind. You start off by describing what is the region. Okay, so in this we will have to remember the template. The first part that I wanted to highlight is identify the region. So this X-ray is the area of left shoulder region. So you need to describe this as an X-ray of the left shoulder region. And next comes the view, that is anteroposterior or a lateral view. So this is obvious, you are seeing from the front and it is an anteroposterior view of the left shoulder region. See, describe all the bones that you are seeing in this X-ray. So you can see the ribs, the clavicle, the scapula is seen, and the part of the proximal humerus. Alright, so that becomes your third point. The fourth point that is important is describe the bone which is actually involved. So that is our area of interest, the bone which is actually involved in this X-ray. Alright, so here in this given example it is the clavicle or left clavicle rather. Okay, and describe the area of interest. Okay, here you need to use couple of technical terms. So area of interest, here what we are actually seeing is a fracture. Okay, so you are able to see that this is a irregularity in the bone, cortical irregularity in the middle part or the mid shaft region of the clavicle, which is nothing but fracture. So this is a case of mid shaft clavicle fracture. Alright, so that is what we are describing here. If required, you can also further impress upon your examiner by describing the type of fracture, or in the simplest way you have different types of fractures. Say it could be a transverse fracture, a comminuted fracture, spiral fracture, and it could be a segmental fracture. So you can use these technical terms to further improvise your answers. Alright, so here it looks like a simple mid shaft transverse fracture of the clavicle region. Status of the soft tissue. So you need to see the shadow of the soft tissue, which can be sometimes appreciated on plain X-rays. If there is any breach, suppose the fracture is lying like this, if the bone is projecting beyond the shadow, so it is suggestive of an open injury, and these are categorized as open fractures. So the last point in describing this X-ray is describing the status of soft tissues. So here you can see that there is a thin shadow of the soft tissue lining. So if there is any breach, okay, if the fractured bones appear beyond this soft tissue status, it is suggestive of an open fracture. Okay, so that can also be sometimes appreciated on a plain X-ray films, and it's not only about the bones. So with this template, it is the right approach. You describe the region, you describe the view, describe the bones that are commonly seen and that are seen in the entire film, then approach the area, territory that you want to describe, or the bone which is actually involved here, and then you can use the technical terms to describe the features of fractures, as I said, and soft tissue in this case appears intact. Alright, so the potential questions that might be asked with this X-ray sample examples. So the examiner might be interested to know what are the common complications or mechanism of injury. Okay, so these are the common questions that are asked. A simple way to describe, see, since I am describing the trauma series in the first session, the common examples of complications, because most of the X-ray films show some fractures. It is very commonly asked what are the potential complications of this injury. So simple way to approach this is, most of the fractures will have 4 different or 4 types of complications which are commonly seen. So you can use that as a template again to approach the individual X-ray films. So the first complication is usually it could end up in a malunion. Should the fracture unite, there may be chances of uniting in a non-anatomical position. So it is called as malunion. The fracture may not unite. So that can end up in non-union. So that is your second complication. The third complication is any fractured bone, usually you have a close neurovascular structures in the vicinity. So they are also vulnerable to be injured or damaged. So any case, should there be a case of X-ray film showing a fracture, potential 4 complications that you can describe easily is these 4 important terms. It could go in for a malunion, non-union, neuro or vascular injury. Okay. You want to further improvise your answer, you can mention the respective neurological and vascular structure which is in the vicinity. Say in this example, the brachial plexus may be involved or there may be injury to the subclavian artery. So that is how you approach and how best you can answer for a given case example. And management, again, most of the orthopedic fracture, especially if I am discussing only with the fracture part, most of the fractures can be managed operative and non-operative management. So that approach on that answer is also acceptable for most of the examiners. So you can mention it as, I would like to manage both as a non-operative and operative management.